Hello again. I'm Dr. J.C. Smith, a chiropractor in lovely Warner Robins, Georgia. And today I want to talk to you about a problem that anybody who sits in front of a computer has, which is tech neck. First of all, sitting is hellacious on your body. It slows down your metabolism. You fall out of shape. You sit there eating junk food and snacks. So it's really a problem. They call it the next step between a heart attack is just sitting all the time. We have a brochure here about how sitting for hours can take years off your life in many ways. But also, as a chiropractor, I see a lot of this with people who come in with low back and neck problems. They call it tech neck, where instead of sitting with a nice curve in your neck, you do this forward motion and you lose the curve in your neck. And what happens is that since your spine is a weight-bearing column, when you move from the normal alignment, you're going to cause problems. First, it's going to be the normal curve in the neck, and see how that reverses the curve. That's what a whiplash can do to you. Or just sitting with your chin in front of a screen will do to you. And what that does, it puts more compression on the disc, and the joints become disjointed. So then it goes, due to that mechanical overload, it will cause the disc to then start degenerating, and then bone spurring and arthritis sets in. And so what do you do about it? You can't give up your job in front of a computer, maybe, but there are things that you can do that I want to introduce to you today. Again, we see a lot of people with this. Here's a good example of a woman with a reverse curve in her neck. She didn't have a car wreck. She just sits all day in front of a computer or at home playing video games. And like I said, it does cause added compression on your low back as well. Here's a chart that shows how they take standing is 100%, but when you sit, it actually goes to 140% of compression on your spine just by sitting. And then if you bend forward awkwardly standing, it goes to 150. Sitting, bending forward awkwardly, like slouching, 185. And then if you pick up a weight, it goes up to 275. On the other hand, lying down on your side is 75 and on your back is 25. But nonetheless, you have to think of your spine as a weight-bearing column. And again, when you get these misalignments, first of all, chiropractic adjustments are great to help this. This brochure here I have talks about how 94% of neck pain patients significantly improve with chiropractic care. And this was an actual study from the Annals of Internal Medicine. Chiropractic plus exercise is more effective than pain meds in relieving symptoms for patients with neck pain. That's what's great news. And more things you can do aside from seeing your chiropractor is learning to use these particular pillows. Most people, I think by now, have tried some kind of neck pillow, and there's a lot of good ones and there's a lot of bad ones. Most of which, the worst one I have found is the My Pillow, that big fat one. It's okay for putting under your knees, but not under your neck, because then it just slams your chin down to your chest, so it actually puts that reverse curve in your neck. On the other hand, this pillow is the Therapeutic pillow. This is an old one here. I've taken the cover off of it, but I've had mine at home for 25 years. You can buy these online. They cost around $75 to $100, depends on how big it is. But the beauty of this is that this is for people who sleep on their back or side. Never sleep on your stomach. Then you have to twist your neck all night to breathe and you wake up with the old crick on the neck. But this is for back sleepers and side sleepers. And the thing is we measure from the neck to your shoulder, and that determines the height. So if you're a big guy, this is going to be taller. If you're a woman or a small child, it's going to be less. But if you lay on your back, see there's that neck roll part right here. You can't see it, but it is there, believe me. And this is a sump for your skull. So when you lie there, it puts that curve back into your neck. And this little tongue is for the upper spine area, for it to rest on. And like I say, I've had mine for 25 years. It's well worth its weight in gold, especially if you want a good night's sleep. And I also go to bed with an ice pack, and it's not my wife. It's a nice, moderately cold, refrigerator cold, not ice cold, and just put it here on top of it, because ice will literally and figuratively chill you out. It's like a natural tranquilizer, but there's no side effects. It just helps you to fall asleep better. So try these. If you have those other ones, like I say, there are some that are okay, but definitely never put a big fat pillow under your neck. Now, if you are one of the poor souls who has a reverse curve in your neck, before you go out and have neck surgery like this poor guy did. Now they just permanently misalign you because when they do surgery, I found, And after doing chiropractic here in Warner Robins, I've come to a few conclusions after 42 years of practice. People are gullible. They walk in with a neck problem and the doctor, oh, you got a bad disc, you need surgery. That is the biggest scam in medicine. And everyone in medicine knows that. But it's the leading surgery in terms of expense. Neck and back problems are the leading expense above cancer, heart disease, diabetes, you name it. But again, just because you have a herniated disc, it doesn't mean you need surgery. The disc is totally secondary. What's primary, here's a herniated disc there. But you have to ask, why does the disc herniate? Why does it bulge and swell up at first? Well, it's because the mechanics are so altered that it will swell like a sprained ankle. But a disc is not the cause. A disc is not a muscle. It doesn't move. It's just a shock absorber, if you will. But when you misalign these joints and then overload the weight on it, compress it, like I say, with bad posture or bad sleeping habits, yeah, you're going to have a swollen disc, but it's totally secondary. And this will shrink back to normal if you adjust the spinal joints and decompress the neck. And that's what these pillows do, especially this Dakota pillow. Now you can't buy this in stores, but we sell it here. They cost $65. They're cheap at twice the price for what it's going to do for you. I've had mine for 10 years, but I was having, even though I have a good neck curve, from all the sitting I do, I was compressing my lower neck and I was getting the tingling into my fingers, swelling sometimes. And the man who manufactures this happens to be an old classmate of mine from Life Chiropractic College. And I saw him at a seminar. I said, Mark, I've got this. He said, Smith, you need that. So he sent me one to test drive. 2 weeks later, this tingling was gone. And if it comes back, which it does, I just hop on, get adjusted and hop on one of these pillows and it goes away. The way it works is that this is flat and your neck, you're going to put your neck like over the pillow here. You see what I'm doing? And it's like, think of this as straightening crooked teeth. It's going to stretch all the muscles and ligaments and tendons and the spinal column itself. Because like I say, people come in with these reverse curves, right? Instead of a normal curve. So if you're like that, you just do the top half for a few minutes, for a few days, and then move on down the spine and do it a little longer. And eventually you're going to be putting this way down at the bottom of your cervical spine and stretching your neck for 20 or 30 minutes. And it feels great. It really does. There's no pain at all. And then once you get used to it, then you start using the bungee cord. You put this over your forehead, and at first you shorten this so it just pulls a little bit. But then as you get used to it, you can shorten the cord and actually pull harder and harder and harder. At first, it's just the weight of your head that is a traction force. And that's enough, like I said, and just work it into it slowly. We have instructions on how to use this, so you don't have to take notes. But it works, and it will help to alleviate not only the tingling down your arms, like these show, but it's also going to decompress that overloading on your disc. So it'll help to shrink it that way. And along with the chiropractic adjustments, which restores the joint motion and alleviates the compression as well on the joints themselves, then you're going to start feeling better. But again, just because you have a ruptured disc like this was a study done in 1994 by the U.S. Public Health Service. And what they conclude, as it says, ruptured discs are not always a pain, because they started finding bad discs and pain-free people back in 1990. That was first discovered. And since then, there's been 34 other studies around the world, so much so that in 2014, the Mayo Clinic did a consensus, and that's exactly what they found, is that by the time you're 50 years old, there's a 50% chance you're going to have some kind of bad disc on an x-ray. But half the people didn't have any pain. By the time you're 70 years old like me, it's like 90% will have an evidence of disc degeneration or whatever, some abnormality, but they have no pain. So just because you have a bad disc or a bone spur, that the likelihood is that can be alleviated, and you can learn to live with it if you follow these steps on how to stabilize your spine. Because 90% of my patients, especially those like say over 30, will show some signs of disc degeneration, disc bulging, bone spurring. I mean, all these arthritic conditions that will invade your spine when it stays misaligned over a long time period. So these can be helped without surgery. And if you're having these problems, the symptoms of neck ache, headaches, tingling, whatever, get off the meds, because those NSAIDs eventually, are going to eat up your stomach, kidney, liver, small intestine, and cause heart attacks. There's no safe drug. Don't think that there is. Use the ice packs for alleviate home care. Start using these pillows, and most of all, go to your neighborhood chiropractor and get an adjustment. If you live in Warner Robins, we're happy to take care of you, but there are, if you're outside of Warner Robins, there's a lot of good chiropractors around. But nonetheless, you've got to learn how to take care of your spine. If you want to learn more, we have other videos that you can also study, and I've got books written on this, or come by the clinic. We'll be happy to talk with you. But anyway, hopefully you take this advice to heart, to neck, and benefit. Until then, I'll see you next time.